Hello and welcome to Askimo TV. I'm talking today to Dr. Matthew Wilson. Dr. Wilson is a consultant orthopedic surgeon at the Exeter Hip Unit at the Princess Elizabeth Orthopaedic Centre in Exeter. Hi, Dr. Wilson. How are you?
I'm very well, thank you. Good morning, Joanne.
Dr. Wilson, let's talk today about hip replacement surgery and some frequently asked questions that people may have. So I'm going to start off with, what is hip replacement surgery?
So the hip joint is a ball and socket joint at the bottom of the pelvis that supports the body weight, and hip replacement surgery is simply replacement of that joint. It can be a half hip replacement, which is when only the ball is replaced, commonly used in fractures, or it can be a total hip replacement when the full joint has replaced the ball and the socket.
What are some of the signs or symptoms that may indicate a person should have a hip replacement?
So a full hip replacement is commonly called for when the joint itself has worn out, typically due to arthritis. And usually the first sign of arthritis is when someone develops pain around the hip, which can be felt either in the groin, the buttock, the thigh, or radiating down towards the knee, and with no pain at the hip itself. In addition to that, some people also experience quite a marked loss of function, so reduced ability to do their day-to-day activities, walking, bending, twisting, and a reduced ability to do the sports that they enjoy.
Talk me through the actual procedure and what somebody can expect to happen.
So typically during a hip replacement, someone will come up to a hospital a week or so before and have a series of blood tests and investigations just to confirm that the operation is appropriate. And then a week later, they will be brought into surgery for the operation. On the morning of surgery, you will see the consultant surgeon, you'll see an anaesthetist, and then when you're taken to theatre and anaesthetized, you're put on typically onto your side with the affected hip placed upwards. The leg is cleaned and draped. And then an incision approximately 10 to 15 centimeters is made over the side of the hip joint. A series of muscles are detached. The hip is dislocated, so that is the ball is removed from the socket. The head of the femur is removed with a saw, and the socket, the arthritis in the socket, is removed with a series of what are called acetabular reamers, which are essentially sort of cheese graters, which remove the cartilage lining of the hip and remove the arthritis. And then a new socket is placed inside the socket, and a new femoral head is placed commonly with a pin down the inside of the thigh bone. And then following this, a head is placed on the end of that pin, the ball is put back into the socket, and the muscles are resutured, and the patient is woken up and taken back to the ward.
What kind of risks or complications could there possibly be to the surgery?
So there are various risks associated with surgery. It is large surgery. It's seen as fairly commonplace and fairly typical surgery because it's very successful, but it is a big operation and people shouldn't forget this, and therefore it has big risks involved. There's the usual risks associated with any type of operation, but in particular to hip replacement surgery, there are risks of infection, which we quoted about 1%, 0.7 to 1% typically of hips will get infected, which is a real problem because that hip then commonly needs to be removed, the infection cleared, before a new hip replacement can be put in. Another risk is a risk of dislocation, which is the ball coming out of the socket. That risk is highest in the first 6 weeks until the muscles have recovered their strength and their tone and the tissues have started to tighten up again. But it's a risk that never goes away. And patients are taught about the positions that they should avoid getting into to reduce the risk of dislocation. Other risks associated with the surgery,
Sorry, carry on.
Other risks associated can be an abnormal lengthening of the leg when inserting the hip replacement. It's rare that patients are aware of any difference in their leg lengths, but occasionally it's necessary to increase and very rarely decrease a leg length.
So what should or shouldn't patients do in order to recover as well as possible post-op?
So the patients are typically given very clear guidance on what they should and shouldn't do during the operation afterwards. We get patients going very quickly, so they're up and about walking, typically the following day and occasionally the same day with the physiotherapists with the aid of 2 crutches, and they gradually get going according to the sort of routine rehab. They're typically in hospital 2 or 3 days, and really for the first 6 weeks, we don't want them to do too much apart from just get their confidence back, get their walking strength back, and increase the distance that they're walking. More vigorous activities really start to take place after the 6-week mark.
What are the alternatives to replacement?
So for established hip arthritis, there's unfortunately very little else that can be done to improve symptoms. In the sort of, when someone first presents with symptoms of hip arthritis, what one tends to do is start with the very simple measures. So simple analgesia, modification of activities and lifestyle, giving someone a walking aid, so a walking stick or a crutch to use typically in the other hand, which takes pressure off the affected hip. And then simple injections, painkilling injections can be of use, although the length that those injections last for is very variable and typically not very long.
Thank you, Dr. Wilson. Thank you so much for talking to me today.
It's a pleasure.